It's Dr. Tom O'Brien of Master Herbalist Empowering Medicine here today, talking to you about Hawthorn. Stay tuned. Hawthorn is a great herb for the heart. And here I have a lovely tea infusion of hawthorn blossoms with honey and lemon. Just perfect for my heart. Beautiful. Buenissima. For many centuries, hawthorn has been used to treat heart disease. There's many legends about the hawthorn tree, that some of them grow for hundreds of years. It's a very special tree. There are many stories about the mystical powers of the hawthorn tree. In Ireland, it was believed to be a fairy tree. In ancient Greece and Rome, hawthorn was taken into the home to protect our homes from evil spirits. Heart disease in America kills 60,000 people every year. And in Ireland, 10,000 people every year die from some cardiovascular form of disease. Heart failure imposes an economic burden on the world economy to the tune of 108 billion a year. So the heart is costing us economically in terms of the breakdown, the failure, the malfunction, the heart disease. Of course, it's our society and our lifestyle and our food choices that is increasing pressure on the heart and on our blood pressure, stress particularly with blood pressure. And what economies are asking now, or governments are asking, is how can we reduce the health burden of different diseases like addiction, liver disease, and now heart disease. My argument as a herbalist is hawthorn. For hundreds of years, hawthorn originally was used by an Irish doctor, Dr. Green, who had a famous formula for heart disease, and he was famous all around the south of Ireland. He lived in Clare, and it wasn't until his death that his daughter discovered that there was a tincture of hawthorn berries. Hawthorn has a history of effectiveness for heart disease, and I always think, what would you prefer? To take a medication, like a pill like this? You want to take, is that the cure for heart disease? How many people now are being put onto statins, cholesterol lowering medications, blood pressure medications, at a very young age? And there's hawthorn berries, hawthorn blossoms growing in Ireland all over the place. The hedges are full of hawthorn. It's a signature of nature that we need hawthorn. It's personal for me. My father is one of those statistics. He died in 1997, a massive heart attack at the age of 62, a young man. And my best friend Joe Lucy, died of an aneurysm. My uncle Tom, heart attack. My grandmother, heart attack. My uncle Paddy, heart attack. Everybody knows somebody affected by heart disease. Heart disease is killing a lot of people, and the knock-on effect, the emotional knock-on effect, the psychological effect on those left behind has an increased burden in terms of mental health, depression, and they end up treating depression, people who are suffering loss and grief. So heart disease has a ripple effect. It's like a car crash. Every time they say somebody dies in a car accident, it has a knock-on effect on 100 people. And similarly with suicide. Death and bereavement has a knock-on effect on our collective health. So 10,000 deaths a year, it's a lot of funerals. It's a lot of money. It's a lot of grief. It's a lot of broken hearts. And it's a lot of pain. So we've got to address the underlying causes of heart disease and stop thinking that a pill, a tablet, is a solution to our health problems. It's not. It's not. It's a temporary emergency response. If I had a heart attack, I'd love an ambulance to take me to hospital. I'd love to be in intensive care if necessary, and I hope if I do have a heart attack that happens. But I've committed to trying to live healthily, eat well, deal with stress, and take as many natural products and natural medicines as possible in the form of herbal medicine. It was one of my motives to study herbal medicine as a result of going to too many funerals and thinking, how can we stop this? How can we protect our health? How can we protect our hearts, especially as men? Heart, emotional health, Men are not supposed to be good at emotions. We bottle up our feelings. We don't deal with anger very well. So in this channel I try to commit to just reflecting my own lifestyle, what I do, and try and teach others to try and make small adjustments. This is free. You just have to learn what's hawthorn, where is it. And this is the first year I got the blossoms. Normally I get the berries probably in August, and then we get tincture. So it's free medicine, plant medicine, wild drugs growing in your backyard, in the side streets, in the gardens, in the parks. That's where they grow. They don't grow in farms, they don't grow in fields. They grow wild, and that's the best place for them. In herbal medicine, hawthorn is seen as an effective food for the heart. Hawthorn has been proven scientifically to be effective treatment for heart disease in many research studies. Of course, hawthorn is a rich source of vitamin C, a rich source of antioxidants. So it helps to rid the arteries of those free radicals, and protects the heart. Hawthorn works directly on the heart by slowing down the heart, slowing down the heartbeat. It increases the intake of oxygen, it strengthens the heart. It's very good, especially very good for people with palpitations, angina, and blood pressure. And the hawthorn flowers, the blossoms, are particularly good for people with high blood pressure. If you are on heart medications, always talk to your doctor before considering coming off them. And if you're interested in herbal medicine and hawthorn, consult with a herbalist and see what they say. We have this lovely hawthorn blossom flower, dried, or you have this little tablet. This is fake. It's only for artistic purposes, and this is real. It's for consumption. No adverse side effects. Just good for you, good for the heart. Feed your heart, take care of your heart, protect your heart. Don't wait for the ambulance to come. I'm sure it will arrive in time and you'll get good treatment in the hospital. But our heart is an emotional organ. It's not just a pump, so you got to protect it. I hope you enjoyed this video. Tell me what you think. Give me a comment, and I'll see you in the next one. Thank you. Take care. Bye.